Hi. So it appears like there actually is some hope on this COVID-19 issue, but the thing that's making me angry is our own governmental oversight, specifically the FDA. So, quick summary. There is a treatment option that has been described, and President Trump himself has mentioned it, which is hydroxychloroquine and azithromycin. Those two in combination, the Chinese pointed out a couple of months ago that they had had success using those two drugs in combination, and a group of French scientists duplicated that effort, and I believe out of 34 patients, 60% showed recovered who had 60% of those who had received hydroxychloroquine recovered, and of those who received hydroxychloroquine and azithromycin, which is known as a Z-Pak, 100% recovered. So you could say, number one, it's a very small test, who knows, not been peer reviewed, and God knows the Korea FDA officials have come out howling about this decision, which was announced late last night. The FDA announced that hydroxychloroquine and azithromycin would be allowed to be used as a treatment for COVID-19 patients on teens and adults. And Trump himself claimed that when he asked the FDA to work on it, they said that they would. And when he asked how long it would take, they said about a year. He said we need it tonight. So say what you will about him. Sometimes his bluster is to all of our benefit. Anyway, here we are. Hydroxychloroquine and azithromycin look like they may actually be a great help. And it's no thanks to those Korea FDA scientists that I mentioned earlier, who were out tweeting furiously about the fact that these things had never been shown to work in animals, according to their testing, that it was irresponsible to allow these tests. The FDA chief scientist for I think 8 years, ending in 15, tweeted something to the effect of, you have to make sure the benefits outweigh the costs when you allow these emergency uses of medicine. I would point out that staying alive does seem to be a benefit. If you're dying, what is the cost to being killed by the attempt to save you? You're dying. It is a benefit. It's a tribute to Trump that he forced the administration's hand, because there's an administration that lives on. Whatever politicians come and go through these various cabinet posts or executive posts, the administration itself lives on, and they have an interest in maintaining the status quo. And I think it is disgusting that they have not acted more precipitously to allow experimental treatments that may help. We'll find out soon enough if it helps. It's going to be used on many, many patients. We'll see if it helps. If it does, will anybody point to the FDA and say, what about your delay? Please get angry and wake up.